Well, good morning, and thank you very much for joining us. I am Yori Folare. The COVID-19 situation is still very much top of mind and top of news in Nigeria. In fact, we have a couple of guests. I got a lot of noise going into my ear. Okay, so as I was saying, we have with us this morning Dr. Oluchi Ubani. She's on Skype in Abuja. She's a medical practitioner. Great to have you, Dr. Ubani. Good morning.
Good morning.
All right,
Good
then.
morning.
Yeah, I'm Yori. We'll be talking on the program just in case you didn't get, you might not have seen that. So good to have you, Dr. Ubani.
Thank you so much.
Okay, then. The situation in terms of how it seems to be ravaging, even though we are hearing that we've got it a bit under control, in terms of how people are going about keeping themselves safe, what's your observation as to the practices? Are we getting used to the new regimes, if that is what one should call it, on how to stay safe in terms of our hygiene, our cleanliness?
Yes, so far in the main city of Abuja, you can see on the roads today, there's not much traffic. People are indoors. Then in the suburban areas, information is spreading because over the radios and other TV stations, this information is being passed in the local dialects.
Okay.
But people are yet to really understand how the perfect way to keep safe.
Oh, okay. I guess we'll be getting better at it as we go along. Now, Dr. Bani, you're an optometrist, am I right?
Yes, I am.
Yeah, so you're an eye doctor, and
yes.
We're told to keep our hands away from our face. We know about the mouth, we know about the nose, but the eyes are also important in terms of contracting this disease or not.
Yes.
Could you tell us a bit about that, please?
Because the eyes has fluids in them, our tears, and then we have the tear film layer, the humors in the eyes. So, and many people, once they have irritation in their face or in their eyes, the first thing is your finger, and they rub, and then you can transmit germs from your hands to your eyes. And since the structures in the eyes are very tender, you can easily get infected. So the eyes is very, very easy and prone to be infected by this virus.
So that's something else for people to know, because you're right. If your eyes itch a bit, your natural reflex is to, you try and itch it a bit. But well, actually your eyes in themselves won't itch, but areas around your eyes, maybe your eyebrows, maybe your eyelashes, your eyelids. So what's the best practice there, doctor? What, to go wash your face?
Before this, yes, before the virus, before this pandemic, we've always advised when you have itchy eyes, you get a clean piece of cloth, put it in clean, cool water, and dab for 15 seconds. Then also, you can also wash your face. After washing your hands, you can wash your face. So you get a clean cloth, dab in cool water, put in clean water, and dab over your eyes for 15 seconds. Then if the symptoms persist, you meet your optometrist, then they will give you the right medication to prevent itching.
Okay.
Because when we rub our eyes, there are tiny blood vessels. There's a waterproof-like structure that covers the white part of the eyes, which is called the conjunctiva. In it, there are tiny blood vessels. So when we rub, we cause the conjunctiva to swell up, the blood vessels swell up as well, and more blood flows in. That's the obvious redness we see. So if there's any virus or any bacteria getting into the eyes, it will feed on these nutrients that the blood brings in and multiplies. So there'll be so much harm to the eyes.
Okay. Now, since we brought the subject up, conjunctivitis, one time back in the day, it used to be called Apollo, but now we have the name conjunctivitis. Is there a greater incidence of that now, or there is no change? And how important is it if you are infected, if you have conjunctivitis, for example, in the scenario of COVID-19?
Okay, conjunctivitis, the term conjunctivitis is just the inflammation of the conjunctiva. And it appears, like I explained earlier, the blood vessels will swell up and then more blood flows in. That's the obvious redness you see. That's the swelling blood flowing in. That's the obvious redness you see, and that's conjunctivitis. So we have viral conjunctivitis.
Okay.
So when your eyes appear reddish, that's a sign. So you meet your optometrist. The optometrist will take precaution, like there's a circular our organization has sent around for proper guidelines for optometrists and ophthalmologists to attend to patients with viral conjunctivitis.
Is conjunctivitis, especially the viral kind that you were talking about, is it catching?
Is it? Can it be
Can,
transmitted?
yes, can it be transmitted?
Yes.
It can.
The general name, the common name, Apollo, is just a general name for any contagious conjunctivitis. It could be viral, it could be bacterial. So if you have conjunctivitis, the pillowcase you use, someone shouldn't use same pillowcase with you. The hanky you use to wipe your face, you should wash them. Your pillowcases, you should wash them. Then people around you, when they start having this feeling as if there's sand in their eyes, sandy sensation or itching, they should avoid using their hands to touch the eyes.
Thank you. But there is, well, I want education from you. Is there any connection between conjunctivitis and the ongoing COVID-19 situation? Or are these two separate things? As we hear that you might have regular flu, that is not necessarily the flu, COVID-19 that we're talking about, other doctors have said. Now, in terms of conjunctivitis, can the two be separated? Are they separate?
Conjunctivitis are symptoms. The underlying conjunctivitis can occur due to underlying problems. So COVID-19 is a viral infection, is a pandemic. So yes, conjunctivitis can occur due to COVID-19.
Oh dear.
So according to the guideline, before a patient is seen that has conjunctivitis, the patient should be properly screened by the general practitioners. That's where the working together of all healthcare practitioners come in, the teamwork. So when there's proper screening of these patients, then the patient is seen by the optometrist and with proper precautions and treated as well.
Okay. Not to stay exclusively on the eye part of it, it's very, very important. We hear that government has released, money to sort of boost medical supplies. What can you tell us of that? Because it's your field. You might have some, primary information on how much this will help.
Okay, the money that has been ingested, though I believe it will be functional, not just words. I believe very soon materials and equipment will be enough. It will really help because we have little testing kits and we have people that are, more people than what we have. Because people are scared of going to test because they believe that we don't have enough. And that's the problem. But if they are confident that we have enough, then people will be tested and this problem will be curbed early. So the more the instruments, the better for us to fight back and the faster for this pandemic to be eradicated.
Okay then. Thank you, Doctor, for being with us. Please stay with us. We're going to, we also have in our Abuja studios, Mr. Ajuri Ngelale. He's the Senior Special Assistant for Public Affairs in the Presidency. And we see, okay, there you are. Good morning, Ajuri.
Good morning, Uncle Yori.
Thank you very much.
To all of our viewers.
Indeed, thank you very much for stopping by. Now, let me just start off with what's in the news. Could you sort of expatiate on the partial close down of, Aso Rock?
Yeah, thank you very much. Yeah, this has obviously been a major speculation, a major story, if you will, across the pages of our newspapers and across our airwaves. But look, we've been very open with the public. Yes, indeed, there is a partial lockdown. We're being very, very meticulous about how we're responding to this issue within the premises, making sure that the areas are safe, making sure that obviously the staff are being tested or have been tested, and we've been pleased with the results. But I think it's extremely important to note, Uncle Yori, that at this juncture and moving forward, our focus has been, is, and will continue to be what is happening outside of Asarok. Our focus is on what is happening amongst the civilian population across the country. We want to ensure that together, collaborating effectively with the civilian population, our people, that we're able to curb the spread of COVID-19.
And could you give me something of a progress report? I appreciate, indeed that is, as it were, the important, but we got to know about the command center, so to speak. Everything, of course, is in the presidency in terms of direction and indeed control, because that's where they're directing everything from. But as you say, the focus is out there, the country. Could you speak a bit to the whole matter of release of funds to augment, if not boost, medical supplies, and just clue us in?
I'm so sorry, Uncle Yori. Can you repeat the last part of your question? The connection broke a bit.
Oh, okay. I was wondering if you could clue us in on government efforts to boost medical supplies and equipment. We hear there have been funds released. Could you just clue us into that?
Yes, thank you so much, Uncle Yori. That has really been the focus of President Muhammadu Buhari and this administration, is making those very critical adjustments in view of the evolving dynamics of the current situation, not just in terms of public health, but in terms of even the economy. And I want to start very quickly on the public health side. I think one of the more underappreciated aspects of what has been happening is that if you look at contextually, if you look at what's happened even in nearby South Africa, relatively, with a fraction of our population, they have over 550 confirmed cases of the coronavirus. Obviously, with 200 million, we have 51. The current situation being that you have approximately 32 cases in Lagos, about 10 cases in Abuja, approximately 3 cases in Ogun State, 1 in Oyo, 1 in Osun, 1 in Ekiti, 1 in Edo, 1 in Bauchi, and 1 in Rivers. That's 51 confirmed cases. Now, the situation for us, the thing that I think is very important to understand is that weeks before the coronavirus even entered into Nigeria, the president had not only released almost $1 billion in terms of an intervention fund to ensure that we have all of the needed medical equipments in place, testing kits, etc., in preparation. But we had already started our airport screening procedures, putting the mechanics together for contact tracing and all of that. And so that is why you have seen the relative containment of the spread of COVID-19 in Nigeria, despite the population density that we wield. Now, with that said, we have been very, very proactive on the economic side as well. We have been very open with our people in telling them about the adjustments we're making to the 2020 budget. That has now moved from about 10.5 trillion naira down to about 9.09 trillion naira. That's a 1.5 trillion naira cut. Now, within that, you are factoring in the removal of PMS under recovery at nearly 500 billion. And then the other trillion, you're looking at mandated cuts that we have imposed on government-owned enterprises. That's NPA, Customs, NIMASA, FIRS, and the like, to ensure that they reduce their internal expenditure, both recurrent and capital, in such a way that we can hike up the operating surpluses to be remitted to the Federation account at a time when we need revenues. Aside from the budget adjustments, we have made a series of adjustments from the monetary side, from the CBN, and they are as follows. For the last several years, we have been facilitating micro and small and medium scale enterprises across agriculture, manufacturing, textiles, etc. What we're doing is, with those facilities that we have already given out, we are going to retroactively reduce the interest rate on those facilities, on those loans, from what was already a single-digit rate of about 9% down to 5%. Furthermore, we're going to extend the moratorium on repayment by 1 year, effective March 1, 2020. So instead of having to pay back in 2020, you're now looking at beginning to pay back in 2021. The CBN has also given reliefs to banks across the country to ensure that that they are able to provide temporary loan restructuring mechanisms to households across the country and to small and medium scale and micro enterprises across the country as well. In terms of cash injections, we have put together a 1.1 trillion naira intervention fund. We have yesterday laid out the modalities of even the 550 billion naira facility that's directed to households across the country, micro and small businesses across the country. All of that is to ensure that at a time when the global economy is slowing down into clearly slowing down into a recession, that we, as much as humanly possible, mitigate the effects of what is going on globally on the Nigerian economy and ensure that we have liquidity in the system and money in the hands of the most vulnerable segments of our population.
Maybe could we talk a little bit more about that, Ajuri, because a lot of people, as we face our population, our society, our community is the way it is. It's much of a daily, survival kind of a situation in the teeming of a majority of cases. They're probably wondering how this is going to work, what with the good news you just cited about the federal authorities actually thinking of how to put a bit of liquidity, a bit of money, a bit of assistance, financial assistance, into the hands of the most vulnerable of Nigerians. That probably is something that is being worked out as we speak, but how is it going to work and how quickly will they be able to, will we, that is as Nigeria, be able to deploy this particular palliative, shall we call it?
Yeah, thank you very much. The 50 billion naira credit facility for households and for micro and small enterprises in the country, we're talking about immediate implementation. We're not wasting time with this. Obviously, we have a separate funding plan in place even for the health sector in terms of how we're going to not just deal with the immediate issues of making sure that we're able to stay ahead of the curve with the availability of protective personnel equipment, with ensuring that we have the medicines and the medical equipment we require. But we're also putting about 100 billion naira in place for pharmaceutical companies to expand existing and open new drug manufacturing plants in Nigeria moving forward, for the establishment also of new research and development and innovation laboratories across public health institutions around the country. We are also putting money in place to ensure that we can expand current private sector hospitals and other medical facilities around the country. We're doing all of this because we see that it's important to not only address the threat as it is today, but we also need to position our institutions more effectively to deal with whatever further threats that may come. And I just want to emphasize very quickly, within the legislature, we've been attacking this on the part of the executive, but within the legislature, we have passed through third reading, set now for concurrence in the Senate, the new Emergency Economic Stimulus Bill 2020. That has a series of provisions that are going to have direct impact on the most vulnerable segments of our population. And I want to be very precise about what those are. First of all, we are going to put in place a 50% tax rebate for every registered company in this country across sectors, whether it's manufacturing, agriculture, textiles, telecoms, oil and gas, you name it, that maintains their employment roles from March 1st, 2020, the beginning of the crisis, right, essentially, to the end of the year, December 31st, 2020. So that means that if you have not sacked anybody, you have not embarked on any retrenchment exercise, you have maintained your employment roles throughout this crisis, we are going to give you a 50% tax rebate on the total pay-as-you-earn deductions for the year. And so that is a major financial incentive we are putting in place to protect Nigerian workers across the country. In addition to that, we have put in place new targeted import duty waivers to ensure that we remove all financial bottlenecks for the importation of targeted materials such as protective personnel equipment, PPE, and medical equipment, etc.
Now, thank you, Ajuri, because all that you said ultimately will be affecting everybody in the country, positively. But when you spoke about the credit facility that you said your government is minded to deploying that immediately, one understands that, look, I don't know how that's going to work, but then there are experts that will fix that kind of a thing. Just about the government, if it wanted to really know, does know everybody's bank account through the BVN system. If it wanted to use it. But how about those Nigerians that are not banked in relation to this matter of receiving a palliative from government, for households who just will not be able to move, don't have anything to go to the markets with at all?
I hope I'm getting all of your question because it cut in and out a little bit. But let me just say that
could I just paraphrase it? Could I just paraphrase it?
In the media, particularly around the idea of whether there's a lockdown of hot zones. We're seeing some steps taken by some state governments. How might this impact on the living standard, on the day-to-day accessibility to basic goods and services by the most vulnerable segments of our population? We want to be very unequivocal and very clear in saying that President Muhammadu Buhari will never allow for a situation that in the name of lockdown or in the name of any preventative measure we're putting in place to curtail the spread of this virus, that we will be willing to in any way sacrifice the ability of our people to access the basic goods, foods, and services that they require for the sustenance of themselves and their families. That simply is off the table. It will not happen. For us, we have been very, very focused on ensuring that, unlike the past, where you have an implementation of federal interventions, you have a kind of a faulty implementation of measures because of a lack of synergy between the federal government and state governments. So what we have done very proactively ahead of time is through the National Economic Council under the chairmanship of Vice President Professor Yemi Osinbajo, we have been really targeting that process of holding the hands of the state governments to say, look, these are the interventions that we want to make. How are we going to ensure that these interventions are equitably distributed across all states of the Federation, across political affiliations and other lines which have divided us in the past? And as a result of that, you would have seen at the last NEC meeting a collective decision taken that there's going to be a ban on social gatherings. There was the establishment of a special ad hoc committee chaired by the Vice President with governors from across geopolitical zones that is going to ensure that these federal interventions we're making, both in terms of household grants, in terms of small and medium-scale business grants, that the implementation of these interventions are felt at the very grassroots across the local governments of this country. And that has been our focus.
Okay, stay with us, Ajuri, if you will. Let me just switch over to Dr. Oluchi Ubani, who is also still with us, and thank you for that, Doctor. Now, you were able to hear, Ajuri there. Probably much that will gladden the heart of you and your colleagues. I'm talking about the medical field now, because you guys are on the front line, actually, at the end of the day. Okay. Dr. Bani?
Yes, I can hear you.
Okay.
Please repeat. Yes, repeat your question.
Okay, no problem. Thank you for staying with us. I was saying that some of the measures of government, we've just been hearing it from the spokesman from the presidency. There probably is much in that will be of interest to doctors as well. But I recall that yesterday we had a call in from Kaduna, and in particular, a gentleman called in there and was speaking about the eye center, the Kaduna Eye Center, and he didn't understand what was going on, and he was saying that they were not admitting patients and they were not letting patients out. Could you? I know. Could you explain the precautions, the extra precautions that health facilities necessarily have to take? Because we've also heard that the hospital can be one of the most dangerous places to be if you don't need to be there in terms of these infections.
Yes, at this time of this pandemic, it is advised that one patient at a time. Now, for your eye care, there are different procedures that are carried out, and unfortunately, most of our procedures needs closer range contact between the doctor and the patient. But at this time, we are limiting the extent at which we come close. It's only at very severe cases, after being properly suited up and protected, you can attend to patients with such issues. But with patients that don't have emergency cases, the doctor can speak to them and advise them on what to do, write prescription on what to use. So patients are not advised to crowd because you need social distancing. They are supposed to give them appointment, not everybody coming at the same time, several and spaced out appointments. So that patient, the person that called in from Kaduna should bear with us. He should reschedule on a better time with his doctor, with an ophthalmologist, optometrist, for his own safety and the safety of the practitioner.
As you say, doctor, there must, with your branch of medicine, close proximity is, I suppose, with all branches of medicine at the end of the day.
Yes.
But you were saying that it's very hard to do remotely. And so that brings into, focus the things that you said. Now, thank you very much. Stay with us, if you will, Dr. Ubani. We'll take a break now, and we'll be right back. And, our viewers around the world will be able to call in as well. Okay, welcome back. These are indeed, what kind of times are they? They're very, very, very serious times. We are thankful in Nigeria that even as the numbers are going up, just one by one, as it would seem, thank God for that, because we're hearing of other jurisdictions, other territories where overnight people are suddenly hearing about 400 or 500 new cases, even as there's also good news that in some areas, I think in China, I think the news from there is that they haven't reported a new case yet. It hasn't gone up. But government has also released a whole host of measures, the federal government that is, addressing this whole situation and how to contain it. We have on the lines, in the first case, we have Ajuri Ngilale. Mr. Ngilale is Senior Special Assistant in the Presidency for Public Affairs. We also have Dr. Oluchi Ubani, who is a medical practitioner. She's also in Abuja. Thanks to you both for being with us.
You.
Indeed. So, in fact, maybe, Doctor, maybe I could hear from you, Doctor. Okay. So, the situation, maybe your impressions, if you will, your impressions on efforts, because I know it's a very, very difficult job, and I was making the point just before we went that you guys, along with all the other practitioners, research fellows, nurses, and all of that, you're all on the front line, and the nation owes you guys a debt of gratitude. The situation about the protection of these invaluable professionals. I just wanted to be sure, what knowledge do you have as to how well protected and prepared all of these professionals are, from your perspective, your point of view, and what no doubt you also will be interested in?
Okay, I think so far all professionals are taking proper precautions, and we're believing that more supplies, more PPE kits will be provided for every practitioner, so that we can work effectively.
The means to do so is available.
Where I am.
The means to do so is available.
So as it's being distributed and gotten, practitioners are getting them, because everyone is highly protecting themselves now. They are very informed. Different platforms, every day we are communicating with each other. Information is being passed on, and we are taking proper measures on how to take care of patients, even with whatever we have. And then also patients are also properly educated, because if we can take care of you and you have the information, they say information is potential power. So if information is given to these patients on what to do, and the right information is being spread, I think the cases will be easier. So I think practitioners in Nigeria so far are taking the right precautions. Everybody is very active and sensitive.
Well, as doctors go, generally speaking, at the very, very base level, they are very highly trained professionals. But in addition, because of this situation, the COVID-19, where doctors themselves are admitting that, you know, we're really learning on this. Yes, we are professionals. We know what we're doing. But we understand that specialist training also is going on in terms of how to protect yourself. Is that, you know, what we hear from abroad, is it also obtainable here locally, that whole idea about training and retraining in this, shall I say, emergency?
Yes, some trainings are going on, and we need more to be done. The World Health Organization is doing so well on their site. So every healthcare practitioner around the world are logged in to listen to the latest information, because the COVID-19 virus is very because they've not totally understood everything about it. Each day, new discoveries are done and spread on the site. So I think practitioners are making use of the World Health Organization site to keep updated on what is done. And then to avoid that close contacts, there are WhatsApp groups and different social media groups where information is being passed on, videos on what to do, how to remove your gloves, the proper way to put on your masks, how to put on the kits, how to attend to patients every minute. So people are on and watching and learning and improving themselves.
Thank you very much, Dr. Oluchi Ubani, for joining us today. Really appreciate you know, sharing your knowledge with us. Thank you very much. You know.
Thank you so much.
Okay, we still have Ajuri Ngilale on the line with us. Okay, there you are. So thank you very much again, Ajuri, as always, for staying with us. I wanted to sort of narrow it down, and thank you very much for the overview, economic overview, and the implications of infusions of funds. But I was asking the other point, which is, and there's a sense in which you covered it a bit, because you were talking about the president was especially concerned that every last Nigerian, nobody should be left out, as it were, in this. How about the unbanked Nigerians?
Yes, thank you very much. For us, that is the focal point, not just during this crisis. Obviously, this administration and the interventions it's made in terms of social investment has been directed at the unbanked community. But for us, the interventions moving forward would continue to just ramp up in that direction. We have to ensure, obviously, working with states. Again, everything that we're going to do has to be in conjunction with the states and local governments. What we do not think is wise is a situation where you're attempting to go to each rural community and hand out hard currency to individuals. That is not the way that obviously you're going to tackle a crisis of this magnitude. The key for us is to make sure that we are investing and making sure that the logistic, the value chains are clear, that people have access to what they have had access to in the past, that there's no hindrance to what they have had access to in the past in terms of markets, in terms of those places where they can get the essential goods that they need. And for us, with the interventions we are making, and we've publicized it, and we're going to continue working very hard to ensure that they are more publicized, is to ensure that our people can key into the new grants and the new facilities that we put forward. Just yesterday, the announcement was made by the Minister of Finance about the grant that is going to enable households to access up to 3 million naira. That is very significant. And obviously, you have so many different households, and we're going to be working very hard to ensure that we're reaching not just the people with bank accounts, not just the people in the formal sector, but obviously the bulk of our population, as you rightly pointed out, that is in the informal sector, that is unbanked. So we have been working very hard on that, and we're going to ramp up whatever we have been doing in the past in view of the current situation. I just want to mention very quickly, a very important component of this is making sure that you're also reducing charges that would be in place if there was no intervention. So, for example, we have within the emergency economic stimulus package. I mentioned about the import duty waivers. I mentioned about the relief for those who protect Nigerian workers. But there's also going to be in place a deferment of mortgage payments for residential mortgages for all individual contributors to the National Housing Fund of up to 6 months. So we're putting a 6-month moratorium on the payment of mortgages across the country. And for us, the reason why I keep emphasizing the cooperation between the federal government and the states is because the states have a massive responsibility in ensuring that they are working with the state houses of assembly and that they're being as proactive as the National Assembly is currently being with our federal economic stimulus bill. It's important that the states also work very closely and evolve very creative solutions that can affect their people within the local governments of the country in collaboration with the federal efforts. It's extremely important.
I want to thank you very much, Ajuri, Mr. Ajuri Ngelale, Senior Special Assistant for Public Affairs in the Presidency, for, as it were, bringing us up to speed. Thanks, Ajuri, and stay safe.
Thank you very much, Uncle Yori. Stay safe, and good luck to our viewers, and I wish everybody a safe stay in Nigeria, of course.
Sure, thank you. Okay, all right then. So stay with us, please. We'll take a break. We'll be right back. Don't go anywhere. Okay, welcome back to This Morning on TVC News. And our man Uche Okoro, has an update. He's in Port Harcourt, and we first put this out last night on our big news.
On the 20th of March, all schools were closed down. Since that period, there's been a ban on public gatherings, open worship, all weddings and burial ceremonies. Public parks, nightclubs and cinemas have also been ordered to close down. Restrictions have been placed on public transportation, while one major market in the city has also been shut. Now the state government is going one step further by closing all entry and exit points in and out of the state.
With effect from 6 p.m. on Thursday, March 26, 2020, the Port Harcourt International Airport, Pamawa, will not be open to air traffic. While we may not have the right to stop flights from entering Port Harcourt, we cannot allow anybody coming from the airport to enter our state. We are confident that the Federal Airports Authority of the Nigeria FAN and other federal agencies will cooperate with us. All land and sea borders will be closed. Vehicular movements in and out of the state have been banned. In essence, no vehicle will leave Port Harcourt to any other state, and no vehicle will come in from any other state to Rivers State.
Governor Wike also said the state narrowly escaped recording an index case recently, hence the need to take such drastic measures.
It is with gratitude to God that I announce to you that our state would have been infected with coronavirus yesterday, but for the vigilance of security agents who, acting on the tip-off, prevented an infected person from boarding a flight from Abuja to Port Harcourt. The infected person beat all security measures that were put in place at the Dissects International Airport, Abuja, and was to sneak into Port Harcourt before security agents stopped her. Based on this alarming information, the State Security Council met yesterday and reviewed measures already put in place and decided that there was urgent need to adopt stringent measures to protect those living and doing business in the state from the virus.
While this latest move by the state government may be commendable, there are concerns amongst many residents that its implementation may not be feasible at federal government-owned facilities like the airport, the seaports, and the East-West Road. Uche Okoro, TVC News, Port Harcourt.
Okay, then, thank you very much, Uche Okoro. As I said, that report was first put out last night, and there will be continuing updates as we go during the day. TVC News is covering it round the clock on many fronts in the country. And okay, as always, oh yeah, there's the phone there. You know, you want to speak, you want to call in. By all means, feel free to do so, as we are, looking at this serious situation that we have on our hands and our efforts to also control it. Well, I don't know if control is the right word, but how to engage with it to the very, very best of our ability. Lagos State and the federal capital are on partial lockdown. Those matters have been discussed. How, it's best to stay put, but then nobody is saying that it's a total lockdown, so that there shall be no movement whatsoever, at least in Lagos and Abuja. I hear Mr. Abiola, well, it might be Mrs. Agbuola. Did I get that right? Is it Agbuola in Ilorin? Good morning. Agbuola in Ilorin, the lines are what they are. There is a call coming in from Ilorin. Hello, can Agbuola, well, evidently, Agbuola, if you can hear us, just go right ahead. Apparently not. Apparently you can't hear us in Ilorin. Perhaps there are other people that are also trying to get in, and it might be the same situation. The lines have been a bit wonky in the past couple of days, but we'll do our best to continue to provide the channel and see if indeed you can actually get through whatever the obstruction is. Even as we speak, you could hear those those electronic sounds. Someone is trying to make sure that we can indeed get a connection. But, one can't say it. I understand that Agbuola can hear us now. Hello, Agbuola in Ilorin. Agbuola in Ilorin. If you can hear us, go right ahead, please. So the situation remains the same. Okay, just stay with us as we take an update from Gombe, again, that was first put out last night.
Are we ready? Yes! Are we ready? Yes!
As security agencies battle to protect Nigeria's territorial integrity against the decade-long insurgency in the country's northeast and fight a rising crime wave, another critical assignment is at hand: enforcing regulations put in place by the government to prevent the spread of the deadly coronavirus. Before deploying, every personnel is educated on how to protect himself.
The police work, we have to be in contact with people every minute. That's why if you lecture your men and officers, they will be able to know how to prevent themselves against this disease when they are coming in contact with the people.
We are the first people to be in contact. So we have to be careful, and especially it is the welfare of the Nigerian police force. As the IG has said, he wished that every police officer at the end of the day should be alive.
Across the northeast region, residents are gradually adjusting to the new normal.
Message for all Christians in Adamawa State.
The Christian Association of Nigeria in Adamawa State is not waiting for enforcement. The chairman has announced the suspension of all Sunday services across the state.
We encourage smaller units or congregational assemblies of 50 people only. We recommend the suspension of Sunday services and masses until further notice.
With an estimated population of 27 million, the Northeast region is bracing up against a possible outbreak. But regardless of how well it prepares, the region remains the most vulnerable. Still, it must continue to shore up its defenses, because an outbreak of coronavirus in this region may claim a devastating death toll. Landry Adiemi, TVC News, Gombe.
Thanks, Larry. That report was first put out last night, and we just played it again. And during the day, we shall continue to give you updates as we get them round the clock on TVC News. But for now, we're going to have to, this will have to be our program. Unfortunately, the phones didn't work we'll continue to work on it. Tomorrow they probably will, and we'll be able to do what we usually do here, engage with you at home, because we want to know what's going on this crucial subject matter from all over the place, as we usually do, be it locally all over the place, be it abroad all over the place. So that's going to be our program today. Please join us tomorrow for a fresh edition. I am Iyori Folani. Bye-bye for now.